You know, more than 6 million women in America struggle with getting pregnant or staying pregnant. Well, now imagine being one of these women who wants to have a child. You're going to a fertility clinic only to be told, we won't help you, you're too fat. That's exactly what's happening. According to a report in the New York Times magazine, women are being turned away from doctors simply based on their weight. Now, it's raising a lot of medical and ethical concerns, as you can imagine. So joining me right now, Virginia Sole-Smith. She wrote this piece for New York Times magazine. She's the author of the book, The Eating Instinct, as well. Thank you so much, Virginia, for being with us. So I want to highlight one of the gals you talked about here, Gina Balzano. She was married for 3 years, 32 years old, and weighed 317 pounds. She expected that she was going to hear about her weight, but no health conditions associated with it, normal blood pressure, normal cholesterol levels, no diabetes. And that leads a lot of people to sit here and think, what did the doctor say to her?
What the doctor said to her was, you're too fat. Have more sex and lose the weight. I can't help you. And, you know, doctors around the country are telling women this. My reporting found that half of the 20 largest fertility clinics in the country and many, many private, smaller clinics have these policies in place where they won't treat women above a certain size. Either they won't give them IVF, sometimes they won't even give them appointments to come into the office, even though there are no medical guidelines requiring them to have those policies. And in fact, the research does show that women can have healthy pregnancies at any size.
So there is, and I just wanted to clarify this, there's no general guideline for health professionals corresponding a woman's weight to IVF. I mean, it's not a health issue.
Right. There are concerns about using anesthesia safely in larger bodies. And there are, you know, small standalone clinics that don't have a trained anesthesiologist on staff, sometimes aren't set up to safely perform those procedures. But that's not what the clinics are saying to these women. They're not saying, we're so sorry, we can't help you. You know, we don't have the technical skills to manage your case, but here's a hospital-based clinic across town that can support you. They're telling them, this is on you. Your body is wrong. Your body isn't worthy of being a mother. And that's a really damaging message, especially for women.
It is. No doubt about it. Do you take this conversation that happened? Do you know how expansive those conversations are? Is that what women are being told by most doctors, or could this have been a doctor that just was one of those doctors that does not have good bedside manner?
Well, again, you know, the reporting showed that half of the 20 largest clinics in the country have these BMI policies on their books. So it's happening in a pretty widespread way. I also looked at research that found that, you know, across the board, prenatal health care providers often show less compassion to their patients in larger bodies. They have shorter appointments. They spend less time with them. They're more likely to refer them for extra procedures and testing. So I think there is a real question about how the role of Wait Stigma is influencing maternal care in this country.
So are they giving reasons for why they're practicing in this manner?
You know, it's very easy to frame it as we're so concerned about the health of the mother and the baby. And of course, we're all concerned about the health of the mother and the baby. That's everyone's priority. That's these women's priorities going into these appointments. But, you know, when we look at the data, we really drill down on the data on the relationship between obesity and fertility. It's not a one-to-one. It's not this dramatically increases your risk. You know, there's no way to have a safe pregnancy. What we see is that women are having healthy pregnancies and healthy babies at every size. And with the right care, with compassionate care, with people who respect their bodies and their bodies' lived experiences. And so it's really an issue of needing to change the conversation, change the language, and change the way, you know, providers are treating these women.
Whatever happened to Gina? Did she ever have a baby?
She did. Gina, fortunately, now is the mother of baby Logan, who just turned 1. But, you know, her story, it took 8 years. She was turned down by 2 different doctors. And after the second doctor told her that she was too fat, Gina decided to pursue bariatric surgery, which is in itself a risky procedure. It takes a year to recover from. It changes your relationship with eating and your body forever. And she did lose the weight. And then she found a doctor who said, you know, I would have given you IVF at your highest weight. There was no reason wasn't for you to go through all that. So that was a pretty heartbreaking realization, to see that Wait Stigma had pushed her to that place that she didn't need to be. And, you know, since the article came out, I'm hearing from hundreds of women who have similar stories. This is not uncommon.
Wow, that is something. Virginia Stolzsmith, it is such an interesting article. Thank you so much for sharing it with us.
Thank you for having me.
Absolutely.